Thank you. And again, I'm one of the old timers that he is always judge on to me. But, I just want to give another shout out. We literally started many years ago sharing clients, me, patients, of people who went through the amazing success of the HOPE program that people don't really understand. It's gone across the country. It's been a successful model in so many different places, and we just need to understand how that has to continue. We also had another honor of, I was fortunate to be asked to chair the opioid policy committee that ended up rewriting all our state laws relating to opioids, which we were fortunate to do that before it really was turned around across the country. And we were in between this guy who was about this tall, and it was that Senator, what's his name, Green. Yeah. So as we now know, our governor was there with us, stepping up, and we were there almost 2.5 to 3 years. So we've had a lot of time working together to talk about the impacts. Well, I want to talk about, I have so many ways that I touched this, and so many of you I've worked with and know all of you, that I'm going to try to bring it back home. We've had a wonderful national presentation, and this data is tremendous. So what I did is I've read the presentations of these gentlemen, and these are the top people in the country that have come here to present. So I'm going to just try to touch on more recent data and then bring it back home. So from my perspective, I just want to really start with the whole concept of how we look at things. And I know there are people here from Department of Health and otherwise, and I talk to our legislators, is what is public health? That's why we're here. We're here for the health of our public. And remember, public health can go to one block to an entire country. And there are different levels that organizations and government can touch that. So we have to always remember we're here for public health. And again, it's the science of protecting and improving the health, promoting healthy lifestyles. So that's pretty straightforward. So I'm going to just really quickly go through. Now, these are all top journals, and I didn't want to duplicate, so I'm going to just try to bring it home to who we're going to be affecting if we do this. This was already mentioned. Geez, even in an August 11th study out of JAMA, these guys have already presented it. But basically, the public has a complete misconception about the dangers of marijuana and the dangers of marijuana smoke. As this study was very well done, it basically shows that they feel it's safe. The kids can be around it. They feel that the marijuana versus a cigarette, no problems, no health problems. These studies will all be available if you wanted to read those. That's huge, and this is only increasing with time, this misconception. We are now in this key age group, 35 to 50. We're at a peak. We are at an all-time high. So this age group is just, if you look at the map, it's exponential for the amount of marijuana use that is occurring everywhere. And again, I'm not going to spend a lot of time, but this was also touched by our group, and it was touched about the use of vaping. And we know what a hazard vaping is. Vaping has reached down into the adolescent age. It's at all ages. And the graph was shown earlier, vaping is going off scale at the same time. This is should be very important, very close to all of us in the state of Hawaii. And that is the data that comes out of dealing with pregnant women. Where does the graph go? It is separating, and it is going off scale. So if we're talking about legalization, we are going to be talking about the number of admissions for this. Even now, I mean, we have a very, very broad practice. This is the number one thing we're seeing in the urine drug test of pregnant women. And so it's out there, but it's only going to increase. And what does it do? Look at what's stated in this study is terrific. Autism spectrum disorder, attention deficit, neonatal age, everything is affected. And if you look at the studies in the places across the country, the graphs are exponentially increasing. So legalization can affect our pregnant women in our state and our future children in the state of Hawaii. The next age group, and that's what I'm trying to do, is just show and make you think and make it to one degree of separation, because we all have family here, who's going to be affected. This is probably our single biggest group that we are going to be neglecting if we don't look at this, and that is our adolescents. And we know that the brain is developing still through adolescence. The data and research is crystal clear. Marijuana use affects the development of the brain, and you can look at these things from memory, judgment, planning, problem solving, decision-making, self-regulation. Think about that one. What does that do for us? And again, the numbers are going off scale for the increases, especially in the states that are having this happen at the same time. This one's just very fresh, talking about, again, more data on toxicity and hospital admissions and pediatric and adolescent cannabis use. And you say pediatrics, well, that slide was presented, the amount of toxicity, the amount of hospitalizations that are occurring in the pediatric age group from accidental ingestion is going off scale, and poison control numbers was presented also. So that's very key. I want to bring this back, and I'm going to try to just make this come home a little bit more. And for people that aren't in the medical world, substance use disorder, okay? What is substance use disorder? We fortunately had a Surgeon General in our country that turned the tides and finally said what all of us who practice this know. This is not just a decision. I'm going to give you a little story. I was going to joke you guys about this and do the same thing, but I had presented to the the military chief of staffs from all over the world that came to Hawaii, and they were asked, Josh set us up to do a talk down at the Senate, and I wanted to get their attention because they had a long day, and it was probably about this size of group, and they were mostly all, generals or above from all over. And I started out and said, okay, first I want to do an experiment. In the back, could you come out and hand everybody a 20 milligram rapid release oxycodone? So I just want to prove my point. Everybody, and they're all going like this and turning around. And I said, okay, no, I'm not going to do it. But I am going to tell you something. This group right over here, in about 20, 30 minutes, their tongues are going to be hanging out. They're going to be laying over their seats, and they're not going to be able to feel a thing. And this big group over here, they're going to look and say, what'd you do? You gave me a sugar pill? It didn't do anything for me. It's all the same thing. They're all getting exactly the same one. And this group over here might start throwing up a little bit and just feeling a little weird. But this group right here, and I saved that for the 4 or 5 stars. I said, this group right up here is going to get up and start dancing on the table. And they are going to feel really happy. But that's what substance use disorder is. It's the same medicine, but they chemically have a messenger in their brain that makes them feel euphoria, that makes them feel different. And then I said, then they're going to want to say, hey, where's more? Can I have more? So we need to understand medical substance use, marijuana substance use disorder is not a single choice. There will be our adolescents. There will be those in the 30 to 35. There will be those pregnant women who will use it once or twice. And there will be a chemical messenger in their brain that will set off and ask for more. Will ask for more serotonin and dopamine to come in there, versus other people, and I'm sure everybody in the room knows this, could basically say, whatever, could use it or not. But that's what we have to understand. We are not creating a choice in this. A few points before I wrap up. I reached out to Alan Johnson at Hinamauka, who we all know and I worked with, and he passed on, this is as of this morning, 800 new adolescents in Hinamauka. 65% are currently with marijuana use disorder. Abby, she's a hero from Poalani, Abby Paredes, who runs dual diagnosis. So that's psychiatric and substance use. Morning data, she got it for me as of this morning, 80% of their dual diagnosis has marijuana associated with it. And then a couple of things just to highlight from the rest of the work I do working in workers' comp. We still, with CDLs, those are the people driving our big trucks and driving those things. This is an important thing to have a clean UDS. Those still occur, and those people are very, very careful about it. First responders, law enforcement, military, we've talked all about that. Workers' comp, we're the largest work comp clinic, and most work comp policy is if you're in an accident of any type, I mean, this can be construction and you drop a log or something or a piece of wood on something, you have to get a UDS. And they're careful. These people, if they want to stay employed, they don't use. So this becomes legalized, there's no effects at that same time. We haven't talked about, but I don't even want to even cross over the fact as I see all of the amazing people that are keeping us safe. How does law enforcement take an impaired driver and do a differentiation of alcohol impairment versus cannabis or THC? It's nearly impossible. And there are ongoing studies, and there's another study that just came out and shows how challenging it is for them to make that decision. And we know, as we watch our fatalities of our young kids on the road increasing. And I'm going to basically just finish with one thing. And I had a medical marijuana patient came up to me the other day and said, doc, I'm off all of my pain medication because I went to the dispensary and the best thing I ever got was cement shoes. I was like, what? Cement? What are we talking about? Cement shoes? She said, it's labeled that it's sold locally, that if you use this, they tell you don't expect to see anything until maybe mid-morning sunshine the next day. That's the potency that we're dealing with. So from my perspective, again, if I look at our legislators, I really challenge everyone to say, what are we doing to protect the public health by legalization? I can't see it as a 35-year active provider in this state. Thank you.